This is Samrawit Marsha, and these are my audience for today. And he's going to be my cameraman. Alright. Hello, guys.
Hello.
Okay, so I just showed you a short video on sleep deprivation before I started my speech. But now I'm going to be more specific and talk about sleep deprivation and healthcare professionals. Before I do that, let me ask you a couple of questions. If I told you that the doctor or the nurse that was taking care of you or your loved ones had a blood alcohol level of 0.01 or even worse, 0.08, would that be a concern to you?
Yes.
Would you feel like your safety was at risk?
Yes.
Yes,
Of course.
I would too. And would you be confident in their ability to make decisions?
No.
No.
Me too. Unfortunately, that is the reality. Research, including British Medical Journal, has reported that a person that has not slept for 17 hours functions at the same level or worse than a person with a blood alcohol level of 0.05. It also found that being awake for 21 hours was the equivalent to a blood alcohol level of 0.08. Mind you, that is the blood alcohol limit for drunk driving in America, in Canada, and in the UK. Doctors work anywhere between 80 to 110 hours a week. Residents, which are physicians in training, work 24 hours and 30-hour shifts. This is required. And it's not uncommon for nurses to work 12 to 16 hours and go home, sleep for a couple of hours, come back and do another 16-hour shifts. Sleep deprivation in healthcare professionals has a detrimental effect on personal health, as well as patient care and safety. Now, let me discuss with you the effects of sleep deprivation on the body. Numerous studies, including a study at Chicago Medical Institute, have stated that sleep deprivation is linked to serious disease such as heart disease, diabetes, mental illnesses including psychosis and depression, obesity, hypertension, and so on. It also affects our neurobehavioral performances, such as our ability to pay attention. I've gone to meetings after working for 16 hours. After working 16 hours, I have been in meetings, and I cannot tell you how hard it is to pay attention. And that is from personal experience. It's extremely hard to pay attention when you've been sleep deprived for such a long time. So it affects our ability to pay attention. Also, our reaction time decreases. So doctors and nurses working in the ER and an ICU have to be able to react fast to medical emergencies. However, when they've been sleep deprived, their ability to react and be alert significantly affected. Also, our cognitive performance, such as memory and reasoning, is also negatively affected when we've been sleep deprived. Doctors and nurses have to be able to make decisions, have to be able to think critically, and when that's negatively affected, then they can make mistakes that can result in serious results. A doctor has to be able to make sound clinical judgments. So when I asked you in the beginning if it would worry you if your doctor had a blood alcohol level of 0.08, and you're absolutely right to be concerned. If our doctors and nurses are sleep deprived, we cannot depend on them to make the right decisions. It not only compromises the health of the healthcare professional, but also patient safety and the quality of care that they're receiving. So what is the solution? Hospitals have to be open 24 hours a day and 7 days a week. So how can we ensure that they're adequately staffed while ensuring that all healthcare professionals perform at an optimal level? Well, the first one is education. Healthcare professionals have to be educated on the importance of sleep. Good sleeping habits. Although it has become the norm, somewhat of a norm, to be sleep deprived in hospital settings, because that just became the culture. We have to break out of that. We have to break out of that mentality. Healthcare professionals have to be aware of how much their performance is affected when they're sleep deprived. We all know that not sleeping is not good for you, but just how much. So we need to educate healthcare professionals on how their performance is affected. They need to realize that their patient's safety depends on their ability to perform at an optimal level. The next solution is a system-wide intervention, such as shift work strategies as well as work hour limitations. And some hospitals have already started to implement this. I personally think it should be implemented statewide because it is about patient safety. Some hospitals, basically what the work hour limitation is, employees are not allowed to work more than 12 hours within a 24-hour period. This ensures that everyone that's working in the hospital at a given time, have rested well and they're not sleep deprived. Sleep deprivation among healthcare professionals is a huge issue that needs to be addressed. In order for doctors and nurses to take care of others, to take care of patients, they need to take care of themselves first, because the sick cannot take care of the sick. Thank you for listening, and I hope you sleep well. Thank you, guys.